Okay. Hello and welcome, everyone. My name is Ellie Zambrano. I'm the Executive Director of the Center for Innovation in Social Work and Health. Thank you, everyone, for joining us tonight for this event, Amplifying Voice, Equity, and Well-Being for Social Work, Health, and Social Service Professionals. Social workers, health providers, and other social service professionals play a valuable role in supporting the health of communities they work with, yet they are often at risk for burnout and decreased well-being themselves due to inequitable work conditions. The quality of service delivered to communities can be impacted by the well-being of frontline workers on any given day. Tonight's panel will explore the connection between workers' voices and their well-being as individuals and as a collective group. We will also discuss the benefits of labor unions and strategies for organizing workers in health and social services. This event is hosted by the Center for Innovation in Social Work and Health here at Boston University School of Social Work and is a part of our Health Equity Speaker Series. Our goal is to provoke thought and stimulate action consistent with the center's mission to expand the impact of social work in healthcare and population health. We define health in broad terms, consistent with the World Health Organization, to include physical, mental, and social well-being, and to involve work at the individual, family, community, institutional, and societal levels. Before we begin, I'd like to review a few housekeeping items. Each presenter will speak for about 15 minutes. Then after our panelists have presented, we'll have some time for audience questions. Please type your questions into the chat window in Zoom, and we'll take as many questions as time allows. If you're a Massachusetts social worker needing continuing education credits for this event, you'll have received a link in your email confirmation to a quiz that you must complete to receive continuing education credits. We will also share the link in the chat. This event is being recorded and will be available on our website at www.ciswh.org. And now it is my honor to introduce our moderator, Mildred Mitt C. Joyner. Professor Joyner is the president of the National Association of Social Workers, which has 55 chapters throughout the United States and its territories. She also serves as the president of the North American region of International Federal Social Workers, which includes Canada and the United States, and is a member of IFSW's Executive Committee. Additionally, Professor Joyner serves on the boards of the NASW Foundation and the NASW Assurance Services Incorporated. Professor Joyner received a BSW from Central State University and her MSW in Planning, Policy, and Administration from Howard University School of Social Work. Her professional career as a social worker began at Chester County Children, Youth, and Families as a protective service worker. After graduate school, she became the first department head and legal liaison of Child Abuse Unit at Chester County Children, Youth, and Families. Professor Joyner joined the faculty at West Chester University in 1979 as an assistant professor and served as the director and chairperson of the undergraduate social work department, a position she held for several decades. Among her many achievements during this time, she developed an interdisciplinary race relations course, which received an award from students for effective delivery of critical content on race. In 2011, Professor Joyner retired from the university and created MCJ Consultants, which specializes in organizational change and achieving equity. She has also co-authored 3 books, Critical Multiculturalism and Intersectionality in a Complex World, Critical Multicultural Social Work, and Caregivers for Persons Living with HIV/AIDS in Kenya, an Ecological Perspective. She has delivered hundreds of presentations at various universities, agencies, businesses, and professional conferences. It is my pleasure to welcome Professor Joyner. We are so glad to have you. I'll turn it over to you at this point.
Thank you. Thank you, Ellie. I thank you for that kind introduction. We are here to talk about a topic that is really critical right now. As we move forward, we have to look after coming out of the bubble, so to speak. What about our health? And what about equity? And I think that this topic today is very critical. You're going to hear some scholars who are going to give us information, and it is critical for us to think about the frontline worker to make sure that they have voice to their life situations. I've just recently have read a couple of articles about people don't want to go back to work, but they fail to really kind of think about the minimum wage that people have received. They forget about how many frontline workers have died due to coronavirus, how many people have an opportunity to create new ways of doing their work. But there are a group of people, our most vulnerable people in our society, that do not have those choices. So I can't wait to hear and ask this panel the questions. And first, we're going to start with Yaminette Díaz-Linhart, who has an MSW and a PhD and is a doctoral candidate, an Agency for Healthcare Research and Quality Fellow, and a health policy research scholar with the Robert Wood Johnson Foundation at the Heller School at Brandeis. She received her MSW and PhD from Boston College and her BA from Mount Holyoke College in anthropology and psychology. Before coming to Heller, Yaminette practiced as a behavioral health clinician, a program director at Boston Medical Center, and directed a legislative commission on postpartum depression for the Commonwealth of Massachusetts. Her research focuses on employment relations for frontline workers through understanding worker voice, work stress, well-being, and work design. I'm interested in hearing what you have to say. Can you introduce yourself to the audience and tell us about your work?
Hi, everyone. My name's Yaminette. A really minor correction is that I'm an alumna of the BU School of Social Work. So very, very proud to be a public health social worker and an alumna from the public health social work program here. I'm really excited to share a little bit of my work and my thinking around this topic. Let me share my slides. And hopefully you all can see this. So happy to be here and happy to get us started. So like I said, I'm a public health social worker and a doctoral candidate at the Heller School at Brandeis. And I'm gonna kind of set the stage for some of what we'll be discussing in the panel today. Let's start by acknowledging the role of work as a determinant of our health. We know based on research that we spend about half or more of our waking hours at work, and many of us will spend a third of our entire lives or even more, depending on each individual at work. And examples of factors that impact our work include the fact that some of us, especially some of us in this field, have more than one job. And the type of work that we do, we all work under different types of conditions. So for example, I know some folks here might do overnight shifts at a hospital. Some folks might do outreach in people's homes. All of these different types of jobs create very different working conditions and demands for the work. Now, it's important to note that there are benefits as well as potential harms to our health and well-being based on the type of work that we do. So our relationship with work is actually complex. One of the important parts of this relationship that we each have with our work and that I like to think about in my research is kind of how we personally experience work. Now, some of us work just to pay the bills. For others, it feels like a calling. It feels like something bigger as part of our bigger, moral universe. There's actually no right or wrong way to experience work. It's something that is personal and is absolutely shaped by our environment. So I'm going to be making this talk a little bit more interactive. And I'd love I'd love to invite you all to reflect on your primary experience of work and what it might be. So we're going to launch a poll and again, invite you to participate. And here, we're just thinking about the primary way you might experience your work. And the choices are exactly what they sound like. So work as a curse is kind of like, ugh, like, it would be great. It's kind of like you know, be great if we didn't have to do it type of thing. Work for money is paying the bills. So just take a minute and answer the poll. And then once we get, I think, enough responses, that was fun because I was able to take the poll too. We'll see if any patterns emerge for, you know, folks on this call. So I'll stop sharing for a minute. There we go. So it looks like 39% of you said work as a service or calling is kind of the predominant orientation or experience of work. And then I think the second highest looks like work is caring for others. And that would make a lot of sense for folks in our profession. And then at 17%, work for money. So you work to pay the bills. That makes a lot of sense. And these are not mutually exclusive. I realize I made us all pick, but a lot of the times there's a little bit of everything in this. So I'm going to go back to sharing my screen. So now I'd like to set some definitions around voice, power, and representation so that as we kind of continue on with the panel, we have a sense of what each of these terms is trying to capture. One of the key themes when we think about these different terms is that workers and employers might have different interests, and sometimes these align and sometimes they might be in conflict with each other. I'm just going to read them. You know, worker voice includes individual or collective efforts of workers to have a say or influence on workplace issues of interest to them and or their employers. Power includes the ability of workers to get employers to do something the employer might not do otherwise. And representation includes a group or organization that speaks for a collective group of workers. And more recently, we've seen this a lot in the caring professions with worker centers. So here's an example of how these concepts might come into play. There was a new, I'm going to share a story. I'm a storyteller. There was a new timesheet system that was implemented for workers in an organization that I worked in. And workers had to physically swipe in and out with their cards. It's not unlike the old timesheet system that I don't know who's old enough to remember these, but, and, you know, this meant physically when you get to work, you swipe in and out. Let's assume the employer decided to try this system because it was going to help managers reduce the burden of having to do timesheets, and maybe it was going to be easier for the employees to track their time. Now, imagine if your work involves community outreach and actually you're hired because of your lived experience or because of your close understanding of the community that you work with. So you schedule a home visit with a family that you're set to meet at 9 a.m., which is when you start work. And this family happens to live 5 minutes away from where you live. So instead of going directly to the home visit, now you actually need to go into work and swipe and then go back out. So it actually creates an inefficiency. Now, employers might not have realized that for certain types of workers, and I think a lot of workers in our industry, that some of the ways that we think about efficiencies in organizations are actually may not really apply because of our different working conditions. So workers could voice and say, hey, this won't work for us. We need the old system because of the type of work that we do. If those workers were part of a union, then part of the agreement could include a travel reimbursement so that if they have to this inefficiency is created, then workers who do all this similar type of work could be the cost could be offset. Or workers could have been part of the decision to change the timesheet system. So taking a little bit more of a proactive approach instead of a reactionary approach, because there the representation of frontline workers who know what their work looks like would have had an impact before the policy would have been implemented. So this is just one example, and I'm sure you all have many examples. And this really leads into why do workers voice? Why do we voice? And there's just so many different reasons we might voice. I'm going to invite you to participate in another poll. And here we have some examples. Again, you may have voiced for lots of different reasons, but let's just think about this past year. This has been a really interesting year. This past year, if you voiced why, and if you didn't, you can say you didn't voice. Workers voice to change how the work is done, to increase safety and quality for workers and for clients that they work with. They're all different reasons why folks might voice. You might voice through your union if you're part of a union, or you might voice through social media, different avenues that folks can voice. We'll take a minute. And that top one should say to change how the work is done. I'm going to stop share. And it looks like the majority of folks who voiced this year, the primary reason was really safety and quality. And that would make a lot of sense because this year, because of the COVID-19 pandemic. And then it seems like improving the work environment and job conditions, as well as changing how the work is done, were the other primary reasons. And we have some folks who didn't voice. And there are lots of reasons why folks decide not to voice. So just gonna wrap up some of my thinking around, I appreciate your participation. So I'm gonna share a little bit about why my work is focused on well-being. And so as part of my dissertation research, trying to understand if there is a connection between workers who voice and organizations that promote voice in the work, and to see if there's any connection to the health, safety, and well-being of their workers. And as an aside, if you're interested in learning more about my research, I will add a link to the chat. It is for community health workers and managers of community health worker programs in Massachusetts who work in hospitals and health centers. And there are lots of reasons why I think this question of well-being is important. One is, and I think this is misunderstood, but our industry is one of the largest employers and contributors to our economy in the United States. The work that we do is actually can be very demanding and stressful. And at the same time, it's very fulfilling, as you notice from how many of us experience work as a service or calling. There's this balance of needing to hold both spaces. Now, I think this pandemic really shed light on the poor working conditions and increased demands of our work. And this is very personal for me too, because we are mission-driven workers. We put others above our own needs and our own health and safety many times. I think we find that a lot in the healthcare and social service industry for frontline workers. So for my last poll, I'm gonna ask if any of you have actually ever left a job because it was harming your well-being or your health or your safety. And I'm asking because sometimes we like to think about when somebody might exit, so leave their job, or they might voice because they're attempting to make changes to their work. So this, have you ever, either this past year or in the past, or maybe you stayed, or maybe you've never had a job that's been stressful enough to kind of, impact your well-being. Just take a minute. We'll see the poll results. So what we have here is about It's a really big number, actually. In the past, a lot of you have left a job because it really has impacted your well-being. The second largest group is you stuck with it, even though you knew it was harming your well-being. And I'm really glad to hear that there's a good 14% of us who've never had an experience where your work was impacting your health. So to wrap this up, I'm going to share some strategies to promote voice. And, Josette will be discussing examples from her own work, and Tom will give us a big picture overview of voice, representation, and power. And here are just some simple strategies. The first is really to connect regularly with other workers and even organizations outside of your own employer. Like I said, there are a lot of different worker centers now that are doing a lot of advocacy work. They might also provide trainings on health and safety. I can think of a couple and happy to add in the chat as well for Massachusetts specific organizations as well. They're also, developing work relationships and a culture where health, safety, and well-being is actually prioritized is something that we can all do. So if you're off the clock, you're off the clock. You shouldn't be picking up your phone. And I know because I've done it or answering emails. But those little things actually will make a difference long term. Now, if you're an employer or a manager, you might want to think about how to include workers, not as an aside or an afterthought, but really to include them from the very beginning in the process of how they can do their work in the day-to-day, as well as in the strategic planning, including boards. There's really, and this goes to the last point, there's really no limit to creative, collaborative relationships between employees and management and leadership. So I think there's actually a lot of potential, especially for our industry, because we care so deeply about the work. The last thing I'll say from my personal experience is that voice is like a muscle. You have to keep using it to strengthen that muscle. And it's really hard to voice. It's hard both for individuals and it's really hard for organizations to promote voice. So I'm going to encourage us all to keep flexing that muscle. Thank you.
Mitt, you're on mute.
I said, thank you for your comments, and we'll have people put things in the chat. I used to have I owe you money. That's one of the things I have about people who forget to get off of mute. So I have a jar, so I'm gonna put some money in a jar. So we're going to move so that we can hear from Josette Hadamilia. Right, and I get this name, and I try to, and I'm trying, but I'm going to do the best that I can. She is the president of the Colorado AFL-CIO. She was born and raised on the east side of Pueblo, California. She received her undergraduate degree from Colorado State University, Pueblo, and completed her graduate studies at Adams State College in 2007. Josette is the granddaughter of Henry Hadamelo, who was a longtime member of the United Steel Workers Local 2102 in Pueblo, California. Josette began working for the Pueblo County Department of Human Services in 2005 and became a member of AFSCME Local 1335 in August. She began her leadership journey as a canvasser for the city council elections in 2009 and was appointed to the elections committee and then the executive board for the local in that same year. After completing one term as an executive board member, she ran for the president of the local. Josette has been serving in that capacity ever since. You can see that in her. She's a leader. In 2011, Josette ran for vice president of Colorado Council 76 for AFSCME and was elected. She served in that capacity for 4 years before running for council president in 2015. She continues to serve AFSCME in the capacity of the Colorado representatives for Colorado, New Mexico Council 18. Josette was elected as the executive vice president of the Colorado AFL-CIO in 2013 and has served that position for 4 years. In 2017, Josette was elected as the president of the Colorado AFL-CIO, making her the first woman of color, first LGBTQ person, and first person outside of the Denver metro area to hold that position. Josette also serves as an executive board member for the National Pride at Work Board. Josette remains committed to her community and volunteers for various organizations, including Southern California Equality Alliance, the Pueblo Latino Chamber of Congress, the Steel City Supporters, and various other nonprofits in Pueblo, California. I'm happy to say I was a member of AFSCME when I was at Westchester Union. So I believe in AFSCME. So let's just hear from her and about our unions and how they're here to protect us.
Thank you so much, sister. I can call you sister because you're my union sister.
Yes, yes.
So just a few corrections. Any place you said California, add Colorado.
Oh.
I love Colorado. I mean, we got a ton of rain yesterday, so if I sound a little congested, it's because my allergies are going kind of bananas. I know that was a really long bio. Basically, what that means is I spend any and all free time dedicated to helping folks get a voice on the job, like Yaminette was talking about. So my 8 to 5 is a child welfare professional. So I'm actually the supervisor of the family resource unit, which is formerly the foster care unit. So we do a little bit of work with kinship families and foster families, diligent family search and recruitment, all of that stuff. So I am a busy human. I also have a 15-year-old elderly dog. So if you see me making angry faces that way, it's because she's barking at me. So anyway, let's talk about workers' voice and let's talk about some real world examples. I don't have any slides just because I like to look at my own face. Just kidding. I didn't think I needed to do any slides. I could throw up some pictures and stuff there, but they're all over social media. So some of the practical applications of policies that come down, not only from the state, but also from the federal level, you know, we get some input into how they're enacted and implicated in our work site. So with my local union, we meet the first Friday of every month for labor management. So when we're talking about things like, I don't know how many child welfare professionals we have, but when we're talking about families first, this is what every child welfare professional in the country is talking about, the Family First Act. We're talking about how does this affect the families that we work with? How does this affect the caseworkers on the ground? How are we going to implement this policy into the work that we already do and make sure that we're successful? Because it's not only for our workers, it's also for our communities. I really liked that there was a really high number of folks who did it, you know, for the good of, I forgot what the option was, but, you know, for the good of the realm. I'm also a very big nerd. You know, we're invested in our community. We live in this community. I think Pueblo is like 250,000 people, so it's not huge. It's not super small, but you know, it is what it is here in Colorado. A little rural, a little inner city, a little of everything. We're able to like really talk about how is this going to affect our families? How is, you know, closing treatment centers for youth and teens going to affect the families that we work with, the kids that we work with? Where are we going to put them? So first and foremost, that is our number one objective, not only as workers, but also as a union, is our community, is the families that we work with. So when we're talking about union organizing, we're always doing organizing internally. So I'm talking to new workers all the time about who we are, what we do, kind of some of the wins that we have, some of the benefits that you get from joining a union, from joining our union. We have like a free college benefit. So for you, for your family, if you want to go out and get an associate's degree, do it. It's free. It's on us. Same thing for your kids, for your spouse. We've got free bachelor's programs. So we're talking about that. We're talking it up. You also get like 10% off at AT&T and discounts on flowers and car rentals and all of that stuff. So, we're really hyping it up. We're really talking about that. We're doing that with every single new hire. COVID has presented a new challenge because I work full time, and I think my sister Mitt like gave all this example of all this extra stuff that I do. I don't have time to go knock on everybody's doors. So we're figuring out new ways to reach folks, email, social media, all of that good stuff, and figuring out how do we get folks to join when they're not actually in the office. So that has presented new challenges for us. We're also reaching out to other counties who do similar work to us. So Adams County, which is about 2 hours north of where I am, they recently formed a union. So it helped that one of my former members went to go work up at Adams and was able to help jumpstart their organizing, really talked about the benefits that she had in Pueblo County and really kind of put those to work up there. So they're bargaining their first contract right now. And they're really excited. I mean, they really are excited to have a seat at the table. And that's really what being a member of a union is. It's a seat at the table for your coworkers. We have, like, our executive board has representatives from all over the agency. So Housing and Human Services has a representative, Child Welfare has a representative, Child Support Enforcement has a representative, Assistance Payments, Front Desk, File Room, all of that. So we all get together and we talk about what's going on within the agency, what kind of policy changes are happening, and then we give feedback to management on a lot of that stuff. So that's kind of how we do that. How does how does worker voice on a local level kind of translate into what's happening nationally? So I think, I don't know if I have to explain the structure of how unions work. I will very briefly. So with AFSCME, we've got my local union, which is 1335. We've got a joint council with New Mexico and Colorado, which is Council 18. And then we have the international union. So all information kind of flows downward and then back upward, and it's super fun. It's not as complex as I made it seem. We have great relationship with our council and great relationship with our international union. What was really awesome during COVID is, we have a national union, so best practices all across the country were able to kind of filter down, and we were able to pass that information on to our management to talk about, how are they doing things in California? How are they doing things in Massachusetts? And how can we, integrate those best practices here in Pueblo, Colorado? So that was something that was really amazing. Right now, I don't know if you guys have heard about the PRO Act, but the PRO Act is protecting the right to organize. So we've been using our worker voice to get on the phone and call our representatives. We've called our congressmen and women. We've called our United States senators and said, hey, this is something that's really important to us. And we think it's really important for workers on the ground, whether you're a steel worker or an electrical worker. The nice thing about being the president of the Colorado AFL-CIO is I get all these free shirts. So this one's from the electrical workers. Give them a little shout out. I get a bunch of free hats too, which is awesome. Also part of the reason I haven't combed my hair in a year, but I digress. We're also working on the public employees' right to organize, which would give us a lot of benefits and kind of make the rules even across the nation, because how you organize in Colorado is not how you organize and form a union in California or New York or Arkansas. So what the PRO Act would do is and the PRO Act is kind of for private sector folks. The public employees' right to organize is for public sector folks, which is what we are as kind of social workers, especially if you work for county government. So just kind of level the playing field. The rules are the same all across the country. Here's how you form a union. You have 50% plus one. Folks in the work site who want to join the union, boom, you get a union. Then you get to negotiate a contract, and then it kind of lays out the rules for how you negotiate that contract and all of that forward. So that'll bring me to my next point, which is collective bargaining. Collective bargaining is this fun term that we like to throw around. All collective bargaining is a panel of union members. Like, I'm not an attorney. I wish I was an attorney. I'd probably make more money. But we sit at the table with the attorney, and we talk about our working conditions. We have a contract, it's, 30 some pages long, that lays out everything from hiring practices to, breaks and lunches. Part of that's in our policy for our county. But we talk about, what happens if only one person applies to be a supervisor? How does that work? Does that person automatically get it? Is there a review process? Who sits on the hiring panel? That's all laid out in our union contract, which is amazing. Right now, we don't actually, in my county, have the ability to negotiate wages, but we're working on it in the state of Colorado. We're working on public employees, collective bargaining. So that'll open up lots of doors for us, because we've been working in my county, we've been working without hazard pay for the last year. Was only recently promoted to supervisor. So for the past 13 months, I was in and out of, foster homes and kinship homes and working with kids. And I avoided my grandma like the plague for 9 months. And that took a lot out of me, but I'm not special. Everybody else in child welfare did the same thing. So once we're able to kind of push and bargain for some of those wages, we'll be in a better standing as a local and as community members, because we live in this community, right? They don't have like a special gated palace for caseworkers. We live in apartments and houses, right? In our own communities. So I think that's important. Some of the real world examples of workers' voice and having a seat at the table is when COVID first hit in March of 2020. My first goal was to get the people that I knew were at the highest risk out of the office and working from home. We were always told these jobs can't be done at home. You can't have access to these systems at home. You can't be on the VPN at home. And my response was, you better figure it out, because I got somebody who's got cystic fibrosis. They could not be exposed to COVID at all. They need to be home now. And those are the kind of relationships that we have with our coworkers that management and supervisors don't even know, right? Like, I know my coworkers. I sit next to them. I go to lunch with them. Sometimes we go to happy hour. I know what's going on in their lives. So we were really able to kind of come together very quickly, put a list of folks together and say, these people need to be home like yesterday. So we were able to do that. And then kind of slowly help identify other folks who, like, they had a high risk person living in their home. They should be home next. Like, I'm single. I don't have any kids. I live by myself. I was on the bottom of the totem pole, but also I work in child welfare. So I already had a laptop. So they're like, go home. We don't want to see you. That's not what they said, but they said, go home and take care of yourself. So I think I talked a little bit, I throw around terms all the time and acronyms. So if I say something that's really weird, like AFL-CIO, I totally can tell you what that means. It's the American Federation of Labor and the Congress of Industrialized Organizations, but AFL-CIO just rolls off the tongue a little bit easier. So we talk about right to work legislation. And that sounds like super peachy, right? Like, oh, everybody has the right to work. Not at all what that is. I think when you look into, like, historically where that came from, it's like baggage from the Jim Crow area. And basically what it is it weakens the power of unions. And unions have always been on the front line of the civil rights movement. What I didn't know until like 5 years into my work is that AFSCME, my union, was on the front lines with Dr. King. And he was actually in Memphis with AFSCME. And, that's a really important historical information for us to know, and to know, where we've been and where we're going. So when we talk about right to work legislation, basically in a nutshell, is it says that you can't be made to pay dues to a union to do a specific job. So like our IBEW folks, they have contracts with certain contractors. They hire our folks. Our folks are highly trained. Like, they have to go through this whole like training program. I've been through the apprenticeship program, and it's incredible. If you ever have a chance to tour one, do it, because it's cool. But what right to work says is you can't make anybody pay dues. That's really harmful to not only unionized workers, but also non-union workers, because it kind of cheapens the labor, right? Like you go through this awesome apprenticeship program, you spend 4 years working your way up to a journeyman, and all of a sudden, like, you're paying your dues and getting the benefits of a contract and getting the benefits of a wages and benefits, but the person standing next to you on the job doesn't also do that. So you guys can do a quick Google search. Like I said, I didn't do a presentation. I probably should have. When you're looking at union membership and you're looking at wages and you're looking at the middle class share of income, those two go like this. So as union membership rises, so does the middle class share of income. Quick Google search, you'll find that chart. There's a ton of them out there. So when we talk about weakening unions and destroying unions, what we're also doing is we're also crushing and destroying the middle class share of the wealth in the country. So that stuff is super interesting. One of the last things that I want to talk about is how does worker voice kind of translate in smaller communities? I think I told you guys I've got about 250,000 folks in my community, which is pretty small. I mean, you guys live in Boston. I've been to Boston. There's lots of people there. But it's different here. Like Pueblo is kind of a small town. We're trying to work on rebranding. Uniontown, we throw up billboards, because we've got a steel mill here. We talked about my grandpa being a steel worker, which I think is super cool. But when we're talking about like outsourcing jobs or laying folks off, we really try to put a face to that job, right? Like I'm not just some union thug. They wouldn't let me carry like a baton to beat anybody up with. Like I gotta use my smarts. I gotta use my smile. But like I'm not just some union worker. I'm not some union talking head. I'm somebody's friend. I'm somebody's daughter. My mom's cut hair in this community for 40 years. My dad worked on cars for longer than that. My coworkers are somebody's neighbor, they're somebody's friend. So having that seat at the table and having that voice in the community has been really important to putting a human face to the work that we do. The media is not kind to social workers. They paint us in a really ugly light, and being able to put a human face to the work that's done, I think has been really impactful. So I'm just going to leave it there. But I hope I was able to give some information, if not, at least make you laugh a little bit.
Thank you so much. Thank you for your for your words and words of wisdom. And we're going to get back to you. I know questions are starting to churn in everyone's mind, but before we do that, we're going to have our last presenter, Thomas Cogan, who is the George Maverick Bunker Professor of Management, a professor of work and employment research, and the co-director of the MIT Sloan Institute for Work and Employment Research at the MIT Sloan School of Management. Well, I will just take that. They call me MIT. You noticed in my name that that's MIT. So a lot of people ask me that question about MIT. Professor Cogan focuses on the need to update America's work and employment policies, institutions, and practices to catch up with the changing workforce and our economy. His recent work calls attention to the challenges facing working families and meeting their responsibilities at work and at home and in their communities. Through empirical research, he demonstrates that fundamental changes in the quality of employee and labor management relationships are needed to address America's critical problems in industries ranging from healthcare to the airlines to manufacturing. His most recent book is Shaping the Future of Social Work. Business Expert Press in 2016 published at that time, Kojin holds a BBA in personal management, as well as an MS and a PhD in industrial relations from the University of Wisconsin. And you happened to see Yaminette had one of her, she actually quoted you on her PowerPoint. So well, I know you just must have, your heart was warm because that second slide was all about you. So let's get in and hear what you have to say.
Well, thank you, Mitt. And we have some kinship here in the sense of sharing a name from MIT and elsewhere. So I'm delighted to be part of this session, and we'll just see if we can get this to show up in a little bit better way. And Yaminette enjoyed together with all of us a seminar at MIT and is part of our community. And we are really benefiting from learning from her work. And I must say, Josette, you are doing God's work in Colorado. You mentioned you a member of AFSCME and that there's some relationship. Well, my first ever fellowship support as a PhD student came from AFSCME. So there you go. I think we're all related in some way. What I'd like to do is to build on what you've already heard and put it in a little bit of a national perspective and to make it clear that you are not alone in looking for a stronger voice, more power at work, and better representation than perhaps you have had in the past. And then once we look at some of the developments in that area, then I want to bring it home to how collective bargaining can be shaped to fit your particular situation by drawing on a case study in healthcare, where I've done a lot of work out at Kaiser Permanente, that is one of our largest integrated healthcare providers in the country. And so let's just talk a little bit about what's going on first in the US. We've done 2 national worker surveys over the last 3 years to try to understand what's happening. What kind of voice do workers in the United States really want and look for? And to what extent are they experiencing it on the job, or are there things that need to be done to improve it? The results that shown on this first slide are pretty sobering. It basically compares a question of says, how much of a voice do you think you ought to have on these various workplace issues? And then how much do you actually have? And so then we look at the gap and we find that over 60% of workers today in America have less of a voice on basic issues of compensation and benefits and promotion and job security, but also a majority are not getting the kind of voice that they think they ought to have around just human respect at work, protections against abuse, how we're going to bring new technologies in to address how work is changing and make sure that it augments what we do. The basic values that our employer stands for, what kinds of services and goods are we producing, and can we be proud of what we are doing at work? These are the modern day issues that the American workforce is concerned about and that they want more of a voice. And so this is what's going on out there in society. More and more people, and this includes blue collar workers, low wage service employees, professionals, all the way up to middle level managers. And so there's a common thirst for more of a voice at work, defined as Yaminette did before. And then when we come closer to the discussion that we're having here, we find that there's also an increase today in the percentage of the workforce that wants to join a union. Now, I've been in this field a long time, and these numbers, unfortunately, will illustrate that, because the first time a national survey asked if you had a choice to vote on whether to be a union member on your job or not was back in the 1970s, in 1977. And that number that came out of that national survey was about 1/3. And the same question was then asked in the 1990s. And again, it was about 1/3. Well, you can see today that in 2017, prior to the pandemic, That number is about half of the workforce. 48% of the workforce that doesn't have a union today says they would join one if the opportunity was given to them. That tells us there's an increased thirst for representation in America today that's not being met. And the biggest increase of the group that's increased the most from the earlier time periods to the current period are people like yourselves, white collar professionals in social work, in education, in healthcare, in IT, and other allied services. It's you are looking for a voice on the job that gives you an opportunity to address the critical concerns that we're talking about here today. But then we went one step further once we found that out, and we did another survey and said, well, what do you mean by a union? What kind of a union are you looking for? And I can go through a highly sophisticated econometric study that is hard to visualize, but let me just give you the basic results of that work because they're pretty profound and they have big implications for the future of labor law that Yosette mentioned. First of all, very strong endorsement for collective bargaining. Workers still want a voice through collective bargaining, through unions on wages, hours, and working conditions. They want it at their workplace. They want it at the company level where big decisions about the future of jobs are made. And increasingly, they even want it at an industry level so that your profession and your social work values and norms can be asserted in your occupation across the industries in which you work. But they also want more services, services that move with people as they move across jobs, health insurance coverage, retirement security, job search assistance, training opportunities, legal representation. And so people are looking for more flexible, agile forms of representation that move with them throughout their career. And then finally, equally important, workers are saying, but yes, we want to bargain over wages, hours, and working conditions, but we have professional norms and values and ideas for how to improve things on our job, how we can contribute to the success of our social work activities, our organizations, and advance our profession. And we want an opportunity to have a voice in how we do our work, how we improve our work, so that some manager doesn't decide to put a time clock, call it whatever Yaminette wanted to call it, in a place that is inconvenient for workers and just makes work more difficult by adding some worker participation into that decision, as Yaminette said. They would never have gone down that road. They'd have found a different way to achieve whatever needs the organization had for that particular activity. And they want a voice at high levels, committees, councils at the enterprise level, and even board membership. So when that says that we've got to pass this PRO Act, the PRO Act provides some of this, but I would go even farther. If we do what American workers are asking for today, we're gonna strengthen the right to join a union and not get fired for doing so. And we are also going to provide some new opportunities for these other activities that workers want a voice on. So that's kind of where we are in the larger picture. But let me bring this home. Let's talk about a set of unions, a set of union coalitions, including AFSCME and including the steelworkers, by the way, that represent workers at Kaiser Permanente, this integrated healthcare organization, both an insurer of providing healthcare insurance and providing services in outpatient clinics and hospitals in California, in Colorado, in the Northwest part, Washington, Oregon, on the East Coast, in the Washington, D.C. area, and in Georgia, and a few other isolated places. But we've studied this organization because in 2001, they created a labor management partnership. And they said, we've been fighting with each other for too long. We need to start to work together to see how we can improve operations here and get better representation in our workplaces. And this grew out of a long history of Kaiser Permanente being organized. First, the steel workers out there in when they were building the Hoover Dam and the other construction projects in the West in the Depression and years following it, and then slowly but surely they turned to a healthcare organization. So this labor management partnership that's got started in 1997, negotiated its first contract in 2001, continues. And by a partnership, what that really means is that they work together. They are not limited to wages, hours, and working conditions in negotiations, but they talk about whatever happens to be important to the delivery of healthcare and to the workforce itself. And they get the ideas from the workforce on how to improve operations. And they sit with high-level executives on a council that says, let's talk about the future of the organization. Where are we going? What are the jobs of the future going to look like? And how can we have a voice in helping to shape healthcare transformation and making sure our members have the skills needed to be successful going forward. In negotiations, they use very much of a problem solving, call it interest-based negotiations, where people sit in subcommittees and really say, what are the basic problems we're facing in work-family balance, in safety and health on the job, in fringe benefit issues. And then as we've pivoted now toward in the period of COVID, how do we make all this telemedicine and remote work and healthcare delivery work? It's one of the leading places for using electronic medical records, and no one has been laid off as a result of that transformation. They found ways to retrain people for the jobs that are available. But what I want to end with is one of the things that I am most intrigued by at Kaiser Permanente. And this is something they call unit-based teams. And in 2005, in negotiations, in the collective bargaining agreement, they said, let's create teams of the physicians, the nurses, the environmental service workers and technicians, the social work professionals, and all of the people at a particular unit. And let's sit down on a monthly basis and say, what can we do to improve operations here? And they use this thing called the value compass, which has these different points that says right at the center is how do we improve our patient and our member experience. Member, they mean the insurance, those who get their insurance from them. That's at the center of their objectives. But they work on everything from improving quality, making it more affordable and less costly, making service improvements, and making Kaiser the best place to work. And here you see the numbers of the kinds of issues that they're talking about. So it covers across the board all of these issues. Yes, there's over 1,000 that are focused on how to improve the place as a place to work. But if you add up all these other organizational concerns, there are even more in those numbers for reducing costs and making it more affordable, improving quality and improving service. Now, I've sat in on some of these, and I can tell you, these are robust, respectful discussions. And you don't know, unless you happen to know the individuals, who's the physicians in this room, who are the nurses, who are the people who clean the rooms, because they're talking as equals and they're respecting each other's points of view and they're trying to add value. This, my friends, in my mind, is the best forms, a best example of collective bargaining at work, at voice at work, at representation that is respected by management and gets the job done and improves operations. So we can make collective bargaining viable, flexible, agile, and address a whole range of issues. And so I just want to end with my suggestion and my hope for how you will think about bringing stronger voice and representation into your profession, into your workplaces, into your personal and professional lives. It starts with what Yaminette said. Speak up for what's important to you. And she asked a whole bunch of questions of us. Well, now you have it's the kind of thing you all need to think about. We all need to think about in our work. What is important to me? And how can I speak for that so that I can really get a voice on those issues, whether it's wages issues or it's respect, it's technology, it's training, or it's service quality. Then you start by building a community of support. We only are as powerful as the community that we build, where we don't just see everyone just as a coworker, but as a human who has needs at home, needs in family situations, needs in mentorship and support on the job. And a good union will help to build that solidarity around your professional norms and around your personal needs and build community on the job. And then not all unions are as effective in really tailoring, as Josette said, about to the particular needs that we have in maybe AFSCME versus the steel workers versus the food and commercial workers versus social workers and healthcare workers. Make sure that you find unions that are responsive to your vision and hold them accountable for doing so. And particularly today, making sure that, and I think Yusette could give you probably some stories about her experience in coming up as a woman, as a LBGT person in her union and getting her voice and her vision expressed with respect in her organization. We've got to make sure that we are diverse organizations, we're inclusive organizations, and we demand that the next generation of leaders reflects even better the workforce that we find in its full diversity and its full power. Then finally, like the UBTs, don't limit yourself to existing structures, create ones that work for you. If a team of at the workplace makes sense, then you form those teams and you work with management to improve operations. If it's something else, then you figure out what is the frontier for how we can find voice at work. That's the beauty that I love about collective bargaining. It's flexible. It can find new solutions. My greatest source of satisfaction come in mediating between labor and management when we find new solutions to problems that maybe have been simmering for a long time. That's what collective bargaining is all about. And that's the labor movement that I believe you can build to improve your future, to improve the future of your profession, and indeed to bring our society back together from all these deep and terrible divisions that we've experienced so starkly in recent times. That's the vision that we could have for the labor movement of the future, and you could be part of the groups that help shape it. So thank you for this opportunity to talk with you, to learn from all of your experiences, and I look forward to the question and answer sessions that we might turn to now. Thank you.
Thank you so much. Thank you so much. We are going to move now to our question and answer period. I know that people have placed some questions in the Q&A section. Some of them are very long, and so it's hard to read and edit these questions. So I will ask that our panelists also look at them so that they get the complete totality of all the questions that are there. But, you know, this has been very interesting. Remember, the title is Amplifying Voice, Equity, and Well-Being for Social Workers, Health, and Social Service Professionals. That's the title of tonight, and we want to focus on that. I know when I began my role at NASW, several people, you know, I actually started in July, which was probably the July of hell when we were going through racial injustice, economic injustice, environmental injustice, and healthcare injustice. And our social workers, as Josette said, was out on the front line holding people's hands as they were dying of COVID. Workers were going out into the child welfare agencies trying to give service. Domestic violence was another area. And social workers were asked to be out on that front line at the risk of their lives and at the risk of their families, because many of them at that time were not issued any kind of protective gear. People didn't think of them at that particular time. We cannot let that happen again. We now must learn from that and figure out how we can use our collective power to really make a difference for all social workers. So one thing that I have been hit with at NASW is, can NASW form a union for social workers? That is the cutting edge question that we get all the time. We're not involved in hiring people. We're not involved in firing people, but we represent over 120,000 individuals in the United States. We know that there are over 750,000 social workers. Is there such a model, Tom? And if so, what would you recommend to us to get started?
Well, that's a very good question, and we find that lots of occupations, professional occupations, organize members and engage in collective bargaining across at a sectoral level, at an occupational level. We see it in the arts and crafts, for example, from construction unions and traditional union to the Stage Actors Guild and the Actors Equity organizations that are professionals that represent people in their profession with the producers and directors and the big production companies of arts, and orchestras often do this as well. So there you can build these. Now, if you look at the history of teacher unions, they all started off as associations at the state level that didn't have collective bargaining rights because they didn't have the laws. And so they first built that community of interest with their members. And then as the law provided opportunities to organize for collective bargaining, they took advantage of that. And so, yes, I would urge you to take your association and then start to discuss with the management associations that are active in social work. Start to discuss with the state legislatures that control a lot of the resources. How can we have a voice? Part of what may come out of the Biden administration's Family First policy may be some new requirements on Medicare and Medicaid to provide opportunities for organizing. So I would urge you to look at those opportunities, figure out the best way to take advantage of them and move forward. And I'll just answer one question down the road when you get to it about the Amazon organizing in Bessemer, because everyone probably read a little bit about that. So I'm happy to do that and answer. One quick question is, at Kaiser Permanente, which workforces are unionized? Nurses are unionized, anesthesiologists and other specialties are unionized. The service employees that provide support, technical support, and environmental services are organized. So it's really across the board. They're the most highly unionized healthcare provider in the United States. And could the partnership have been formed without the union? No. When Yaminette puts the word power in the middle of her slides, that they required a show of power through unionization and collective bargaining to get to the point where management said, gee, I think we should work with you rather than fight with you because you're too powerful to avoid. And so I think that's absolutely essential.
One thing that I'm going to ask you all that was in another, in the chat room was about microaggressions. That is a new word that just kind of evolved, but it also has its own cultural implications. And so we have to look at that through a completely different lens. So microaggressions in the workplace. Tell me, Josette, just how you help someone deal with a supervisor or who says, this person's coming after me. We see this a lot of times in higher education, where you may have someone who's tenured, who just go after junior faculty in a way that they have no voice, strip their voice. How would you help them use their voice in the workplace?
A really good question. I think when I think of microaggressions, I think of like racism light. I think like those kind of things happen to my mom a lot. And she's like very, very acutely aware when they're happening. Um, I go through life just like doo, doo, but my mom very is in tune with that. And so are a lot of our workers. Um, a lot of our folks aren't used to advocating for themselves in that type of manner. So I get lots of calls about stuff like that. I get calls and emails and texts all day long. But what we really do in that kind of situation is I will offer them some advice and I will say, like, here's your options. Like, let's go to the administrator and have a conversation about this. I'll offer to sit in with them. And we have a really great relationship in our work site with our managers and our deputy directors and our director. So they'll let us sit in on some of that stuff. And it's really kind of a coaching, advocacy, kind of big sister role that I'll play in that and really kind of help them navigate that conversation with their manager and really talk about, hey, this is what's going on at my work site. And then usually the manager will offer to kind of do some kind of mediation with, whoever they're having an issue with. If it's something like that, where it's like racism light, after that meeting is over, I'll usually stay with the manager and say, you got to pull this person in. That's unacceptable. We don't play that way here in Pueblo, or at our work site, or really anywhere. You shouldn't play that way. It still happens. But I think, we have a really good relationship with those managers that I can say that. Like, you need to bring this supervisor in, even if that supervisor is a member of mine also. That's unacceptable. I don't care who you are. You don't get to act that way. And I think we really have a culture of respect in our workplace, and it's something that we've worked really hard to achieve, and also a great partnership with our managers. I think they've also come to me and said, your union steward was really, really aggressive at this meeting. You need to talk to them. So I've also had that conversation on the other end. But absolutely, we certainly do a lot of coaching and a lot of facilitating of some of those really tough conversations.
Okay, thank you. Yaminette, you got a shout out from Dean Peoples. Wilkins is here, and she said great work. So I just wanted to give you that shout out, that you have someone that's in your corner there, that we all appreciate all the contributions that the dean has made to social work. But I want to ask you this question. What about about internships? The question is, what are individual and professional wide impacts do you think that the unpaid internship for social work and other health professionals have on employment, equity, and well-being? What are some of the thoughts on how to address any negative impacts?
This is a great question. Actually, I remember just a couple years back, I'm on the BU School of Social Work Alumni Board, and this actually has been coming up quite a bit for students. And again, it doesn't just impact social work. There's, I think, a whole economy built on internships. It reminds me of a newer folks are researching this, and there's a newer term that is called the legitimization of passion exploitation. And this essentially is talking about how workers that feel like their work is a calling or service, like we talked before, are more likely to be exploited because they know that they'll volunteer or they will do the work and beyond typical pay. So I think for schools of social work and for other schools to think about, and even field placements, to think about how to provide some type of stipend or wage is really important. I really think that we are in a place where we really do need to think about just a livable wage for students, especially, and not rely so much on people's goodwill and really kind of caring service that they want to bring to their communities. So I think we have to start talking more about money. We have to start doing the right thing in terms of finding funds and money to be able to take on interns in a way that really is going to promote their well-being and their safety, because they're able to eat, they're able to sleep well, they're able to pay their rent and have basic needs met. So I think there's a big opportunity to creatively fund internships in our field and moving forward in, for all types of students.
Okay, thank you so much. Yes, it's time for schools of social work to, I just recently happened to hear where a young fellow went out, he was playing in the NBA, but he left school early. So Under Armour took him on for a semester for an internship. And then the next year he joined the NBA. You know how much his internship was for 3 months? $1 million. Right? Just something that that just kind of blows your mind out of how companies such as Under Armour or maybe other companies can help to give us money for working in the community rather than $1 million for one summer. Wow. Just wonder. So Tom, I'm going to circle back to you about what happened with the Amazon workers. People believe in unions. My dad was in World War II and was in he was an electrician there, came back, went to Drexel, was in the electrical union. At that time, it was very racist. I mean, he fought, took those tests, but he got his union card and was able to hire other electricians and have them become journeymen. Why do people shy away from joining the union? And what happened with the Amazon workers in Alabama? Can you tell us a little, give us some insight?
I'll do the best I can. I was not directly involved, but
No, or just why there's such a fear of
Yeah.
joining a union.
Yeah, the reality is today, and I put a little of this in the chat, that the promise of labor law, that is that workers should have the right to join a union. They should decide whether that's what they want to do or not want to do. That promise is not being delivered under our current law and hasn't been for a long time. The law is deeply broken. So today, when the Amazon workers in Bessemer say to the union that is active in the community, we think we want a union, they go out and sign up cards and say that we have enough that say we should now have a right to have an election. And then the fight begins. And Amazon, in this case, hired a whole bunch of new employees that were not part of that process to dilute the union's support. And they offered a bonus, like the intern, only $1,000 to anybody who would leave. So some of the workers who wanted a union took that, were dissatisfied enough to take that action. But then the vicious managerial opposition. You talk about a lack of respect for basic human dignity. They put posters about why you shouldn't join a union inside the bathroom stalls.
Mhm.
Now, how much more of an insult to human dignity can you experience from getting that kind of propaganda there? They have captive audience speeches where they require people to show up, and they tell them why a union is not in their interest. And they use all kinds of other consultants and legal maneuvers to defeat the union. Now, did the union really have enough support to make it work down there? I don't know. But that's the reality of union organizing today. And when management, the evidence from one of our PhD dissertations a few years ago is that when management resists union organizing, 9 out of 10 times you never get to that collective bargaining agreement because they are so powerful and the balance of power favors them. And so we've got to have, whether it's the PRO Act and the particular provisions of that bill, or the PRO Act and maybe some other things that should go with it, in my view, and what the American workforce is telling us in those survey data, we need a fundamental change in labor law. We need to make this a public issue, and that's why sessions like this are so important. Take this message out to your community. Talk about it in your community gatherings, in your professional meetings, in your unions, in your churches or synagogues or whatever one does to meet with people you care about, and make sure that we start to raise our voices and say, let's let workers decide what's in their own interest. We'll all be better off as a society.
Thank you.
Can I
Josette,
yeah, I'm chomping at the bit over here just to
I
interject.
want, you want to interject something, or can I ask you a question and then you can do both?
Yeah, ask me a
Okay.
question and I'll do both.
Okay, so what strategies should social workers use to increase voice and power in private nonprofit settings with relatively strong workforces and without any unionization? What are practical ways of managing up? You know, we have these small not-for-profits, 2 people here, 3 people, and they work 24/7, just like you do, right? So what strategies would you have?
So I'm going to piggyback on what Tom said about
Mhm,
Amazon and why people fear unions so much.
mhm,
Part of that is because historically, we are terrible about sharing our own story, about who we are, the faces in the union. Like, I'm not some union fat cat who's like living high off the union wage. Like, I make just as much as the other supervisors in my unit, and I don't get any money from the union.
mhm,
Sure, they reimburse my gas if I got to go to a meeting, but not the time I'm taking off from work to get there.
mhm,
So we need to get better at telling our story. We need to get better at talking about what it is we actually do and who we are, instead of it being like this mystifying, like the union. Like
mhm.
all the unions are is a collection of people who go forward and talk about their collective ideas with the managers. Um, we also get beat because we don't have as much money as Amazon. So
Mhm.
that is my rant and my side note about what Tom said. But I think using some of the same um, tools that we have as an organized local for some of the smaller nonprofit folks is really just setting aside time to say, you know, collectively we've talked and we think these are the best ideas to move this organization forward, or this is a practical way to implement new policy, or a practical way to, you know, do our job, or split caseload, or whatever that is. I mean, that's really all we do. Um, you know, we've got, yeah, we pay dues to an organization to make sure that we've got the backup, um, and, you know, staff to kind of help manage some of these, you know, contract fights and stuff like that. But really what you could do is meet together as employees and then present, you know, to, if it's an executive director or a board or however your structure works, you can say, you know, we've gotten together, you know, the 10 of us, the 3 of us, the 4 of us, and we really have come up with some ideas about how we can implement new policy, or we've looked at this policy as employees and this is why it doesn't work, and these are some examples of how we think it can better work for our agency.
Okay. We have time, Elliot? You know, I know you wanted to.
I would love to answer one question. If it's
Okay, well, let me let you answer this one question, because I know Ellie, we stop at 7, and I want to make sure we give her time to sum up, because this is a discussion that needs to continue. This is not just a one and done. Go ahead.
So I wanted to, somebody talked about working in a hospital and having more strategies and examples of organizing across disciplines. And someone also asked about organizing across different organizations as another example. And something that has helped me, I'm channeling back my community organizing course from social work school, and I'm thinking about Lee Staples at BU has a wonderful book called Roots to Power. And I actually was able to use a community organizing approach in the workplace where I was, and was able to bring together multidisciplinary team to create a symposium to support community health workers. And one of the reasons this was so important is because I realized for my own social work practice, and also for the work that I was doing together with community health workers, that there were so many programs, right? You could be in a really big health system or even in different organizations, but you're serving the same communities. And you're kind of all in your own island and you're in your own silos. And the best thing to do is really come together and have a conversation around the issues that are going on and decide together what might be something you could do together. And it could just be something as simple as visibility. Maybe we just want to know how many of us are there doing this type of work. I think now with the virtual platform and the technology, this is something that we could do virtually as well. And it's really important, and it just takes an idea and a spark. And I encourage us all to really draw from community organizing, because it's been a really helpful strategy in my work personally.
Thank you. Thank you. I know that there were several questions in there about NASW. I'm prepared to just answer the fact that, when you look at nurses and teachers and law enforcement, the numbers that they have to be able to carry out these activities are far greater than what we have in social work. When we get that 50+1, social workers have to be more active in our voting and have to be more active in NASW and come to the table and help to carve out programs that are going to address our wages and our healthcare and our well-being. Remember, in social work, right now we're running an election and less than 10% of the people vote out of 100,000 people. I'm going to ask you and give you the challenge to come to the table and to bring these issues up and to demand that changes be made, but it takes you to be a member to join so that we're able to do that. Just as Josette said, as president of NASW, my pay is my volunteer time. And so we have many volunteers, a very, very thin staff. So we have to build up to rev up. And so I say to everyone who is interested in that, bring it home to your chapter as well as to the national office, and we'll form a committee and get started and study this and do what is right for our members, for social workers, because we do know that we are at the cutting edge of everything. We are the frontline workers, and we have to better our life experience. We just had in our code of ethics self-care. How can you self-care if you're working 24 hours a day on problems? So, we're here, we're interested, and we will pull our seats up to the table. Come join me. Ellie?
Yes, thank you. Thank you, everyone. Thank you very much to all of our panelists and to Yaminette, our moderator. We know how busy everyone is, and we appreciate you sharing your knowledge and your valuable time with us tonight. I also want to thank the BU School of Social Work students, Molly Zatoni and Jasmine Keene, as well as our communications manager, Nalaja McCoy, for their leadership in organizing tonight's event. We really hope that this information from our panel can help you take some action in your work to advance health equity and to improve your working conditions. Thank you, everyone, and have a good night.
Good night.
Good night.
Thank you, panel. This is not one and done. We're going to bring y'all back again. Bye-bye.
Okay.